I'd like to welcome the expert experience panel. I'm going to get them to raise their hand, indicate who they are to match the names. We have Phillip Nguyen, Sophie Athen, Stephanie Sandbtook, and Rhys Liskaser. So for the five of us, I guess, are all reasonably experienced consumer representatives and consumer advocates, probably in various stages of being jaded or enthusiastic at different times. So I'd like to actually start off by asking the consumers on the panel to tell us a little bit about themselves, why they're here, and what they want to achieve by being a consumer representative. Just a short intro. So, yeah, grab the microphone. Yep.
Okay, thank you. I didn't quite expect that I'd be the first one to be asked, but I'm happy to do it. Look, no, that's fine. I was just sitting here listening to the two speakers, and really I've been involved as a consumer advocate for a long time. I think it's getting close to 20 years. So it says I'm a perennial optimist, or I'm a deluded, whatever you want to call it. I've been involved in terms of my personal experience in the areas of mental health, disability, and this is all as a carer, aged, dementia, chronic conditions. So I've looked after a number of members of family where I've had to have multiple, numerous, ongoing, continuous encounters and battles with the health system. And I can tell you where it doesn't work, how it doesn't work, why it doesn't work. Talking about integrated health, it's a real area of what I consider to be a huge problematic area. I was very fortunate, if I'm allowed to share an experience of what I think was the epitome of a positive experience, because the rest of it is quite negative. And that was that I was very fortunate to get a physician to work with Mum, my mother, to look around her comorbidities. And through my work, as I was case managing Mum, and his work, we were able to make my mother's life a lot easier in the last 12 months of her life. And that was because of his compassion and care, talking with me and with her, and actually stepping in every time the system failed to take action to make sure that integration was happening at a level which was the least disruptive for Mum, and Mum being the focus of having the care. So I will be forever grateful to that specialist for actually putting my mother front and centre, and actually picking up the phone and ringing and checking and chasing and making sure that everybody who was part of the team that was supposed to help her, including many numerous hospital presentations. So that was absolutely brilliant, and it made life a lot easier for my mother. So it can happen, it does happen, it can work. 99% of the time it doesn't, but it only happened because of that individual's commitment, compassion and understanding. And I think it's wrong that it has to depend on one person, and myself as well. It should be a systemic approach around how we actually treat and work with people. I have to say the health system works really well for 80% of people. 20% of the time it harms people. I'm sorry to say, it actually causes harm to people. So I'll leave it there.
Thank you. We'll come back to some of those points.
Can I ask a question?
Yeah.
I would like to put to the audience the question of, having heard and listened to the two presentations, does anybody here in this assembly feel that you're actually doing it well and doing it right, and you're actually engaged effectively with a whole range of your community and with your patients? If you are, if you're brave, put your hand up.
The first step's being in the room, I think, so that's good. So, do you want to...
Okay. My name is Phillip, and I come from the Eastern Health region, and being a consumer representative member, I've been exposed to a variety of different panels and boards that have been inundated with people mainly within the, I guess, the elderly sector, senior. My own personal story with that is that I deal with, I guess, people who, yesterday being Remembrance Day, people of that ilk, they come with a lot of experience that they've been to war, so they've experienced quite post-traumatic disorders. So as a result, as you talk about patient-driven care as an aspect, it's mainly what so Dennis has mentioned, empathy, having a lot of respect for them to ensure that they're able to communicate and tell their experiences with what they've had. And I suppose with the presentations today, it's been a good sort of opening and insight into where it's going and how we can all ensure that people who are looking at maintaining the independence are able to do so.
Would you like to go?
Hi, my name's Steph and I'm from Sydney and I'm with the North Shore Local Health District, and I'm probably just your kind of run-of-the-mill health consumer. I'm a mum with 2 teenage kids. My experiences are going to emergency when someone's dislocated their knee in a hockey match. I'm a nutritionist, so I'm really interested in health literacy around keeping people healthy before they become acute. So I think Dennis mentioned complementary medicine, and I think integrating health coaching, nutrition, health literacy as part of someone's journey so that we're looking after ourselves before we become sent to hospital with a pile of brochures. That's where I'm coming from. So I'm involved in lots of different projects in the Innovation Committee. I'd like to see more use of technology. Unfortunately, that costs money, so we won't talk about that. But yeah, so that's my story, and I'm here because I'm interested in taking what we see today back to Sydney and sharing that with our district and seeing what they can make of it, and yeah, sharing between states and districts and communities, I think, is a good way to spread the word.
Well,
Thanks,
that
Steph.
leaves me. As I said before, my name's Rhys Liskaser. I'm also a consumer rep and a consumer advisory committee member from Eastern Health. I'm also a semi-retired registered nurse. I've got that as that was my profession in another lifetime. Now I'm a mother of 2, and I work for my husband in his medical practice. So I've sort of been able to look at both sides of the story. Just a quick reflection on integrated care and patient-centred care. I trained at St Vincent's Hospital, Melbourne, just around the corner. Great hospital, that. Basically, I was always taught in my training to treat a patient in a holistic manner, and it's so lovely to see that all coming back to the patient again, once again, that core value that St Vincent's had instilled in me. I worked as a associate charge nurse of peritoneal dialysis unit at St Vincent's, and part of my renal training was basically involving integrated care from that stage, where we actually did that without this whole form and this concept that's now being sort of introduced, which I think is fantastic. I mean, we took patients from before they were admitted, as most of you would know, train them, teach them about their disease processes, teach them about possibility of infection, giving them the confidence, the safe space to be able to talk, to feel valued, to be acknowledged, to have their fears dismissed, so that they didn't feel like they were just their diagnosis. They were an actual person, and you're willing to work with them, not telling them how to do it, but just to encourage them to be involved in the healthcare. And I think that's a wonderful thing that we're doing now. And all I can say is that also from a carer's point of view, Sophie mentioned about how good a physician was helping her mum, and I too have been a carer of a lot of members in my family. It's funny, you might retire from you might retire from nursing in a paid position, but you never really seem to get off that treadmill at home. Everyone seems to think, oh, you're a nurse, okay, you'll do, and you're sort of constantly going on nursing for the rest of your life. And basically, I too nursed my gorgeous father-in-law, who I absolutely adored, and he went through a lot of issues, medical problems, one after another, and basically I had a lovely physician who basically, was able to speak to him despite the fact that he had a hearing issue. He was hearing impaired, and this particular doctor would sit down and talk through us, and took his time. It was never a hurried moment, and I think that had a huge impact on him, my father-in-law, who felt he was valued. He wasn't being hurried and just sort of basically written down and ward round comes and ward round goes sort of thing. He had time to question about what's happening to him. He had time to make the decision that, well, there's nothing else available. So he was able to then be involved in that care of, basically moving into palliative care. And that was a big decision for the family to take. But the support that we got from the physician and the allied health was tremendous. And all I can say is, I will be, like Sophie, forever in debt to this particular doctor who was just the most generous of person with his time, with his, he was respectful, he acknowledged my father-in-law for who he was, and he gave us the support that we needed. And all I can say is I'm so glad that we're moving down that pathway. And I think, consumers have a lot to give. They have lived experience, and something that when I was a nurse, I would always assume that I knew what they were feeling, but you really don't know what they're feeling till you ask them that question. And I think that communication, the transparency is so important. It's vital to get anywhere and to actually be able to prescribe the care and support that they need. I think you need to have that conversation.
So that you both mentioned, or you've all mentioned, some aspects of integrated care that have actually been helpful. A number of them have been individuals who have actually had that as a sort of focus in terms of their patient care. What other sort of aspects of integrated care or well integrated care do you think you can identify that would be good to have in place that isn't in place at the moment? What are some of the deficits in terms of integrated care?
Well, I think it's the patient and their carer that do the transition from tertiary to secondary to primary, community, and back again through that system. So the patient knows what the barriers are and the difficulties. And the barriers are systemic, from big systems issues to little systems issues, depending on who your tertiary provider is, whether it's you ring the phone and nobody picks it up, or when you're in hospital, the discharge notes don't get prepared, so you don't take the discharge papers with you when you're discharged, or they arrive to the clinic, if they arrive at all, to the GP 2 or 3 or 4 weeks later, and the patient might have already died by then, which was one case for me. So the system has people. Look, I've got to say, even though I'm frustrated and really fed up with the way the system is and what it does to people, and I've seen a lot of people being broken by it, I really think that everybody in it is really working hard to try and make it work. So people are willing, they're compassionate, they have an understanding, but they're under a lot of stress themselves. And the systemic barriers that are put in place end up making people act in a way which is really not for the patient's interest in the long term and benefit. So you have issues around repeating your story 500 million times, files getting lost, prescriptions being incorrect, not sending the right prescription list to the GP, so you're on old medication, not new medication. The referral is not coming through. You have to repeat a number of tests 3, 4, 5 times because the GP referred you, the specialist referred, so you did 1 test, 2 tests, you go to the hospital, you have to do another range of tests. I mean, this is really not only expensive and costly to the system, but can you imagine someone who's older, has had a hip surgery, has had a heart condition, having to traverse all of that backwards and forwards because, I'm sorry, the MRI, the CT, the X-ray didn't arrive, I couldn't access it, it's not in the system, and on it goes.
So it sounds like some of the aspects are about transmission of results and data and well, just communication between both the GP and the hospital and various specialists, between people involved in imaging and other places, and that actually doesn't all marry up, so there's a lot of duplication.
But it also has an impact on the person's health and well-being.
Absolutely. Yeah.
Can I just say that an example that I've seen which really stood out for me is Western Sydney Local Health District have got an amazing program called the Coach program, and it was featured in the ACI as a spotlight for consumer enablement. And so they trained integrated care facilitators. So they had a person that would work with someone with a chronic condition, a heart problem. This chap, he made all the appointments with the GP, he spoke to the specialist, and then he would also check in as a health coach. How are you sleeping? How's your diet? Do we need to get you to a dietitian? General lifestyle care, as well as following up all of his appointments, and this guy could not speak highly enough of it. There's a video out there if you want to check it out. Really great consumer focus, engagement, taking care of this man, and his journey's been fantastic. So that's a really good story, a positive story of where integrated care and integrated care facilitators worked fantastically.
Steph, what was that program called again?
It was called the Coach Program. So it's on ACI, and it's the Consumer Enablement Spotlight series on health coaching. So I really feel that health coaching and integrated care facilitators, if we could train every single district to have, you know, a number of them, then you can really focus on a person's journey and follow them through along the way.
So that it kind of reminds me a little bit of something that Danny said, in that we need actual people in roles to actually assist with some of this. It's not about within our existing systems that they're sort of so strapped, and the way they're also structured in silos means that we need something more in the middle. I can give an example of that in that with my mum, multiple hospital admissions. On one of them, she had major depression, so she was under the care of a psychiatrist. And on one admission, through ED and then into the ward, and her consultant took her off all of her psychotropic meds. So in addition to being already frightened and feeling unwell, she then started to experience psychosis. So when I asked about this and had they communicated with her psychiatrist, the consultant said to me, well, psychiatry isn't real medicine, so it doesn't matter. This was at a major Melbourne hospital, I have to say. And then in addition to that, there was no discharge plan document sent back to her GP. And I think we can all probably give examples of that over and over again. But one of the things I'm wanting to know is whether how you think the system needs to change to empower and enable consumers to take a more active role in their own healthcare management. What do you think's needed?
Well, health literacy is probably the first thing, is to get people to understand what's happening out there. Can everyone hear me? Yeah, sorry. And I think also too, and I know everyone is strapped for time, and being able to make that extra, just a couple of minutes to explain to your patients exactly what's going on, I think empowers them, allows them then to understand what you're planning to do with their health and what sort of care you're wanting to implement. And I think that's coming along, and I think that's probably the first thing is, making sure that there's health literacy around and there's, less medical jargon when you're talking to your patients.
And maybe a different approach. I mean,
definitely.
I think probably, I know that a lot of hospitals have been trialling the rounding at the patient's bedside as a way of trying to improve some of that input. But actually, really, what it is a bunch of people coming and talking at the patient about what people have perceived happened to them during the day, and there's actually not much opportunity for that patient to say, oh, did you think that? The reason I was upset was because, someone actually put me on the toilet and left me there for 40 minutes. I think part of this is not about people being inhumane or health workers not wanting to do the right thing. It's actually about just treating one another with the sort of mutual respect and with a bit of openness, as we were talking about before, a bit of openness and porousness to, bring down some of those role divisions. It's not going to hurt to actually ask a patient what they think. You may not agree with it, but it's not going to hurt because it'll actually enhance their experience of care, and it might actually enhance your treatment and diagnosis as well.
Yeah, can I just add that for those that are already in care, particularly with the digital interfaces that are now available at a lot of hospitals, it's worthwhile mentioning that they are also given time with, say, somebody who knows that user experience, that user interface. So like that slide that Anthony showed between, walking on gravel path and walking on the street that was more friendly, it's worthwhile just giving them the opportunity for themselves to learn. Maybe not with ones that require care that are quite extreme, but those that are wanting to be independent or wanting to be having that sort of freedom that would allow them to really get their health back to where it needs to be, and showing that they're able to get back to where they were prior to being admitted to a hospital.
Yeah, I think it's sort of a cultural shift, really. In lots of ways, it might be people and structures and mechanisms, but actually it requires a whole culture to change, I think, within health services generally, within GP practices, within hospitals, within rehab centres, across the board. I think the culture needs to shift, and that's going to take really good leadership, I think.
If I could just add one point, that for some reason, we avoid raising the issue about the power inequity. There is a power issue here, and which is part of cultural shift and cultural change. And until that power, unequal power or inequity around who's got power and who's got control over, we will never be able to successfully achieve the focus on the patient, and the patient being the driver or even being the builder of the whatever it is that we're talking about. So in many, many ways, and the little bits of the system that come together, they automatically, in different ways, treat everybody as if everybody's unique number 101, we're all the same, and we all require the same things. We're not, and the system doesn't respond to the needs of us as individuals at all. It's set up in a way to kind of like mechanise, like, production, mass production, and it needs to change and become focused in terms of how society has changed, and society is changing, and a lot of patients are doing things differently and going overseas or going into complementary medicine and so on, whether it's good or bad. I'm not going to comment on any of that, but I think it's important to know that for whatever reason, we as patients have disempowered ourselves. We've allowed the system to overwhelm us, and we feel that for some reason it's sacrosanct and we can't really challenge it, we can't really question it. And I mean, we would never dream of going on a holiday without investigating everything and ensuring that we have a car waiting for us, we've got all the visas, so we do all of our homework for all of that. But for some reason, we're not that capable in doing a similar kind of investigation when it comes to our health.
Yeah, very true. I guess
Sorry, I just to follow on with that. I was here at the conference yesterday, which was amazing, and one of the speakers put up a slide which I think would be very relevant to what you're just saying, Sophie, and it was by Albert Einstein, and I'm not sure if all of you saw it, but I thought it was fantastic, and it stated that you cannot solve a problem from the same consciousness that created it. You must learn to see the world anew, and it is a new world out there. And what I find is that it's, and a lot of patients, I mean, even though they want to be in the driver's seat, often aren't. They are more than willing to work with their physicians. They want to be able to collaborate. I think the whole point is about collaboration, isn't it? It's about being able to work in together to feel valued and to and if they feel that they don't understand it and they feel that it's something that they don't want to do, and I'm sure they would then relinquish that to their physician to basically format that care for them. And yeah, but it is definitely
true. I think the power thing and the collaboration takes guts. And I mean, this health system has been the way it has been for a long time, and it takes guts on both sides to actually both ask questions for fear of being seen as the difficult person or the difficult family member, or also from the health practitioner's side of saying, well, is that part of my role? What if I ask and I don't like what I get back in return? That sort of thing. I remember about 7 years ago, I was CEO of a primary care service, and on the second week, I went out and I actually sat in the waiting room, and the staff were petrified. I hadn't said to anybody I was going to do this, and I could see all the reception staff looking at me, and the doctors as they were coming out thinking, what's she doing? She's talking to the patients. And I learnt more about how the patients actually experienced our health service in that half an hour of sitting in the waiting room than I would have otherwise. And I think sometimes you just need to make that time. You need to make the time and say, well, people sat there, they said, oh, it's horrible, it's drafty, everybody looks at you when you get out of the lift. Oh, I always see my neighbour down here. There's no barriers between it where everybody sits. So that smelly guy that comes in, he always sits next to me. There's nowhere, where the people who come in to see the guy that's the alcohol and drug specialist, they always seem to sit, next to me, and I feel unprotected, or I feel like I'm a number. Some of the GPs actually come out and just say my name really softly, and then when I don't turn up down the hallway, they grouch at me. So, it can tell you a whole lot of things around your service, and I think, that doesn't take much time and can be really helpful. One of the things that I wanted to do today was actually see if members of the audience would like to ask some questions and just make it as a free-flowing conversation. Would anybody like to ask any questions of a panel? Yep. We've got microphone bearers coming forth. So I think the lady in brown after that. Yes, please.
Sorry.
Sorry, we're swapping around.
Thank you. I feel very special. Thank you. I'll be hereforth referred to as the lady in brown today, everybody.
I should have said the cute curly hair, but anyway.
The day's going beautifully. I just wanted to ask what you saw were the levers that our funders and policymakers could actually exercise in encouraging this. And I guess in asking that, I'm reflecting on the fact that, consumers have things that they can do to drive this change, and health services do as well. But, I'm going to get sort of a bit emo for a minute and just say, I'm well aware of clinicians that literally have cried at the end of the day because they have been so conscious of the fact that they haven't felt like they could do what they wanted to do for their patients, and they really do want to come and be part of this change and make these meaningful improvements to quality of life for consumers. And I think it's a three-way exercise. A lot of our success is measured in activity, as you know. What can we do with funders and policymakers?
Do you want me to start? I think that embedding patient-reported outcome measures would be one of the things that might actually help with some of these levers. So things and clinical, and I guess some clinical outcome measures as well that actually mean something to patients. So it doesn't mean much to patients. Some of the outcome measures aren't really as important as others, and I think things like was the care integrated back to your community, or did you feel like you were involved in your care and thoroughly informed and asked about options and so forth? I think those things are important. Obviously, in terms of funding levers, the way our hospital system is funded through activity-based, and it's also the way GPs are funded through activity-based, both work against good integrated care, and I think probably they would be the key drivers. But then you still do see good integrated care in some situations, even with those constraints. So I think probably I'd come back down to saying I think it comes back to some leadership as well in health services, and perhaps starting in one area of your health service, and building up your expertise and your confidence with working with consumers in a partnership, and then get better and better at it. Develop your resources and develop your people to help go with that, and put pressure on the government to perhaps fund some of these roles that would help with integration and what did we call it before? We called it service, directing people in the right direction and mediating the gaps.
I think I would move a little bit further than what has been suggested, because I think we've reached a point where the system is not sustainable. We actually need to start looking at different models of payment, and also acknowledging that Yes, it's a good step, and a lot of these things are good suggestions, but I think the system is broken. I think there are a whole range of issues around it. So maybe it's time to have a three-way conversation, as you put it, at the high level, but at multiple levels, to see what might be a better model around how we can deliver better health. And because health systems tend to be regressive, as in they perpetuate the models that no longer work forever in a day until someone actually comes and says, well, I'm no longer paying you for that, therefore you will not be providing that service. We never look at, in terms of what's at the horizon, what's in front of us, the vision around the future and how the future will which is technology, as was well put by Phillip. Consumers are now taking the power and making decisions and looking after themselves in a different way to what traditionally has been happening in Australia. So we need to take that into account, because that's also got some issues around safety, quality and so on, because people are moving into Southeast Asia, into Europe, into wherever, to try and deal and address some of their health issues because they're no longer satisfied with the current health system. And I don't even want to go down the pathway of private health, public health, insurance, pharmaceuticals, competing markets, vested interests, and who's benefiting and who's losing out of this equation. But we need to have that conversation, and really soon, because the system is leaking millions and millions of dollars that really it needs to be addressed.
Can I just follow on from that in regards to technology? And again, it comes back to time. Everyone's time poor, but we are a generation of technology users, and it's going to get further, ahead in the future. And I really think we should be focusing on checking the funding for telehealth, giving people better access to telehealth. So you've got, that's a perfect example of integrating care. You've got a patient who struggles to get in to see a clinician. You can link up with your GP, your specialist. Everyone can have a conversation. The appointment's booked online. They just have a link. Everyone can communicate. You can ask one question to 3 people at the same time. You're not repeating the same story. They could bring up your images, have a look at what's going on, and really start going into that cultural shift of the future, And with telehealth, the struggle is, how are we going to fund it? How are we going to charge it? Everyone's looking up, what's the number to bill this? It's just not easy. It's got to be pursued, but not just for rural, like in the city as well, It's hard for people to get the tram. It's difficult for people with ambulatory issues to make these appointments. They get the train, they walk up a hill to a hospital, with a walking frame. It's crazy. They could be at home and just pick up the phone or press a button. It's just the way of the future. It's got to start happening. Home nurses should have a phone with data. They should be able to take a photo of a wound and send it to the GP and say, I need help with this. Is this a hospital case? Can we keep this person at home? Do I have to send her into hospital? Reduce the hospital admission, keep the patient comfortable. That's where we should be looking, to the future of technology.
Yeah, I think that is a great idea, in addition also to things like family meetings. I think I probably have expanded the number of family meetings happening in Melbourne and Sydney, because every time I get the phone call like you do from the family, so-and-so's in hospital and they're not listening to them and so forth. They say, ask for a family meeting. And it is fabulous because, again, you get all the people around the table and not everybody is intimidated by Dr. So-and-so or Mr. or Professor so-and-so. So they actually ask, well, what's going to happen when they go home? They can't actually manage that, and you're going to talk to so-and-so. So I think they are really good mechanisms as well. But I think this is bigger than Ben-Hur, and I wanted to ask the person who very nicely gave their microphone away. Did you want to ask that question?
Sure, thank you very much. Stephen Ginsburg, I'm a GP from Sydney North Primary Health Network. It's a comment and a question about language. We use patient, person, people interchangeably. Now, patient creates quite a different power relationship between the healer, healthcare professional, and the person. I believe there's quite a lot of discussion about this in sociological circles. Some people come up with a slightly clunky word, citizen, because it suggests that there are real rights for that so-called patient who's in the subject position so often in health. So I just wondered whether, systemic change can perhaps come from an examination of language. In our PHM, in our community council, we have a saying, you say, we do. And I think the consumer Australia, they used to say nothing for us without us, and now I think it's changed to done by us for us.
I think, language can be an issue, but I also think we perhaps don't get too hung up on it in a way. I know that in the GP world there's a lot of conversations around the notion of the patient relationship, and I know we need to keep this short because we've run out of time just about, but in a way I think it's probably best just to say to the person you want to talk to, what do you prefer to be called a consumer or a patient or a citizen or a whatever, or do you want just your name? I think that we've got to get back down to the fact that no matter who we are just ordinary people. We might have different qualifications, we might have different lives, we might have different incomes and so forth, but I think in the end we are just all people who suffer or who end the day in tears because they can't provide the care that they want to do. So I think, there's enough interest in integrating care that we're only starting, and I think it's a shame that we're only starting when the system is really broke. But I think we need the energy and a bit of chutzpah from you guys to push this through. I'd really like you to see all of the participants today going back to their health services and their health funders and saying this is really important because we're actually losing faith in the system. Yes. One question here and one over here, and then maybe we need to finish up.
I'd like to thank all of the members of the expert panel here this morning for your contributions. It's wonderful to see you. And I would like to follow up on a comment which might have been about your role as consumer representatives, ranging from frustration to enthusiasm and empowerment. Could you tell us a bit about the things that make your role as a consumer representative an easier or really exhilarating process rather than a frustrating process?
So for myself, I'm, compared to probably most of the members here, one of the lesser experienced ones. You may have seen on the stats too, being a male, it's not common either. So I bring a whole entirely different perspective from time to time as to what a consumer representative would do. In terms of what I've been exposed to, there has been one that stand out whereby I actually took a tour of the back end of a hospital. So when patients have medical samples or are undergoing tests and are waiting for their results, that to me was a whole day that session took. And we went through the pathology lab, we went through the histology lab, we went through the basically all the equipment that's used to separate blood, serums and the like. So to me, that was eye-opening. Like, you wouldn't get that opportunity unless you were employed by the hospital. So by being a consumer representative, it's given me the opportunity to really understand and see just how intricate and I guess attentive all the staff members who work behind the scenes, what it's really like. So unless I told them, the general public would not know the amount of detail that goes in. Like, if you maybe going through a documentary such as putting on ABC Catalyst or something, going through all the different stages of step one, step to the finalize of how a patient gets admitted and then gets released depending on the severity of their case. So in the case of somebody who needs an amount of care, that could vary. So it could be if they're going through anything that may be mentally disturbing, even it may not be that, and then so they may have to do other checks, and through those physical checks that could take quite some time. So for myself personally, I found it to be it's been a really great experience to get that sort of understanding and knowledge that not everyone would be able to attain.
Oh, can I add to something in there? part of it is you were saying what makes it, enjoyable or what makes it frustrating. I think what makes it frustrating is when you're aware that you've been invited to participate in something that is one of those, pretend jobs. We've got a such and such committee, but we're going to make a big deal out of looking like we listened to them, but but nothing changes, but we've ticked a box on a quality assurance thing. That's the infuriating bits, or that you run up against sort of administrations that won't change stuff even though all their staff are willing. But I think on the good side is that sometimes you can make simple changes actually happen, and that gives you a real buzz. It's a real, just by giving some feedback and suggesting a different way of doing something, and you actually see some results, is fantastic. So recently I was involved in a process where Mildura Hospital, I don't know is there anybody from Mildura Hospital here today? No? Was not actually using the statewide, we have a statewide stroke neurology service where 24/7 there is a stroke neurologist in the city available to rural health services to actually provide secondary consult to people in emergency and then guide their care. We actually achieved Mildura actually getting their act together and joining up 3 months ago. They've not joined up for the last 5 years. That was a buzz. So, there's some, when you get outcomes and when you get respected. On the steering committee for the integration project from the very first meeting, I felt very respected and my needs met. As you would have seen, I have mobility issues, so there was care and concern about that, and there was payment for transport to get there, because otherwise I wouldn't have been able to afford the $80 to get a taxi to the city. And I think simple stuff like that. Most of us, yes, we might be probably fit the bill in terms of who the consumer advocates are, but on the other hand, a lot of us are on pensions or on limited income. So financial support and someone to liaise with in terms of those support needs to enable you to participate is really important too.
Absolutely, totally agree with all of that. I just think from my perspective, if I'm approached, and I chair a number of committees, if I'm approached from the very start as to we have a problem or this is what we need to address, and I sit down from the very beginning around how to resolve and how to bring about that change and how to make consumer engagement effective and meaningful, then really and truly by the end of that process, and it's reiterative, so it keeps cycling again and again, because you keep repeating that cycle, as in we move on to the next thing, we move on to the next thing. It means that at the end of the day you have real outcomes, meaningful outcomes, where you feel that you have been truly respected and truly engaged as an equal partner. Unless we're equal, we will never achieve the outcomes that we want to achieve, because it'll be at the end of the day what the system preferred or modified or changed.
Thank you.
Can I just quickly say, sorry, I had a wonderful experience being part of a project of escalation of care at Box Hill Hospital, and as a consumer representative on the Clinical Deterioration Expert Advisory Committee, I had the opportunity of actually go through all the documents to have an input as to how I felt how they should be escalating and what responses basically the patient should be hoping for, and that came to fruition a little while back, and that was lovely acknowledgement of my input, and I think that sort of gave me a buzz about being involved.
That's great. Can we have one last question before we need to let people go and have something nice to eat and drink? Something wrong with the microphone over here. Do you want one of these?
Oh, got it. Can I thank everyone this morning for the really stimulating conversation, the earlier speakers, thank you very much, and for you for presenting as a panel. It's not easy, it takes bravery and courage. But can I remind people that we are all actual consumers of health and care in our own right and in our everyday lives? That this isn't something that we're anomalies to. We are all it. Sometimes it's a them and us. Those are not them, they are us. So I think it's a useful reminder to remind ourselves we are all consumers, and therefore our experiences, whether we're workers in the system or not, are really important parts of that. And I guess part of what I want to say is also around, we've listened today, and we've certainly tried in Wales to take the views of people. We've looked at and worked with our advocates on a continual basis. We still find it very, very hard to be heard and to be taken seriously. And some of the most important messages are often the very simple messages. They are the most simple messages around very often basic, simple communication. We've heard some of them today, and my plea is, this isn't huge, this isn't hard, it's about basic communication, compassion, and really sincere care. And I suppose my plea to the audience, all of us here today, is, I guess, what are we all going to do differently, having left here today, having listened to, a great debate about the realities of what we're all here for. Thank you.
Couldn't have said it better myself. That's fantastic. Thank you very much. I think that's really good. Thank you all for attending. It's been great to be here with you, and thank you for allowing us to go over time and staying put for a while. So I want you to go forth with that chutzpah and make changes. Bye.